really hard to think of a healthcare organization, not just in the United States, but maybe worldwide, that's been more significant than Intermountain Healthcare now for decades. Right across the board, Intermountain is able to design and redesign care as an example for the whole world. I've learned from them. They've been extremely generous in reaching out to others to help them understand what Intermountain has learned through the years. The medical landscape would be phenomenally different and far less favorable without the contributions that Intermountain has made.
There is no institution with a finer reputation for quality and innovation than Intermountain. It is an organization that is meeting the commitment of those who challenged it to become a model healthcare system.
Our goal in Washington is similar to Intermountain Healthcare. We want to bring the cost down while at the same time giving high quality care. There are some other great systems in this country, but Intermountain is certainly at the top of the list. And I believe that they set standards that if other healthcare systems will follow them, they'll do a good job too.
Intermountain is an organization that's been devoted to providing high quality, high value care for years. Intermountain has been able to put together care delivery pathways that are considered across the nation, around the world, to be absolutely defining in terms of excellence and impact.
Higher quality is associated with lower costs. If everyone could practice the way Intermountain is, we could probably reduce the cost of healthcare in the United States by 30 to 50%.
Welcome. Thank you. Well, it's great to have so many community leaders, political leaders, educators, Intermountain caregivers, and our governance here today. I do have a small question. Is there anybody still working in Salt Lake today, right? So I have a very slight vestige of new guy status left here. And what I'm hoping to do today is to take this opportunity and share an initial report of what Intermountain does with you, the community, so that together we understand what we're doing together to make this a better place, but also to figure out where we're going in the future. So over the next hour, I'm going to share with you what we've been up to, but most importantly, the touch points between Intermountain and the many communities that we serve. There are really three takeaways that I'd like for you to have today. First, I'd like you to understand that our goal at Intermountain is to make sure that we have the healthiest state in the United States with the most affordable health care. Let's be really specific. The highest quality care at the lowest per capita cost that's possible. We have an intense focus on the lives that we touch. And we really believe that based on the hard work that has come before and the culture that we have, as well as the operational capabilities, that we're very well positioned to change healthcare worldwide based on what we do here in Utah. I think all of us recognize that there's a really strong correlation between the economy and healthcare. And we believe that healthcare costs play a big role in the ability to attract jobs. As many of you know, Utah has the #1 ranked economy in the United States based on a number of different ranking systems, but specifically via Forbes. We also are the #1 economy for business with several different references, including CNBC and the U.S. Chamber of Commerce. We think that actually that the healthcare costs here play a big role in that. So if you look at commercial insurance and you rank the 350 biggest cities in the United States, we have 3 cities in Utah that are amongst the lowest 10 cost per capita of any cities in the United States. We don't think that's an accident. If you say to yourself, well, that's just commercial insurance. Those are young, healthy people. If you look at Medicare data, what you can see here is that Intermountain sits at the high quality, low cost sweet spot of exactly where one would hope that their state would sit. What I'd like to start with is, we'll go ahead and dive in at this point. I'd like to talk a little bit about the roots of Intermountain, a little bit of our current state, and a lot about our caregivers, because we really, really strongly believe that it's all about the people. Beautiful physical plants, great technology, that's terrific. But it's really about the human beings that touch other people that make all the difference. So where are our roots? And our roots are based in generosity. So in 1975, the LDS Church gave 15 hospitals to the community, with the governance for those hospitals being placed in a not-for-profit that has since become Intermountain Healthcare. What's really quite amazing is that in 1975, the mandate was very simple. Be a model system, be a model healthcare system, be a beacon to others. So that mandate, those inspiring words came at a time when no one was talking about health systems. The foresight, the acknowledgement that healthcare plays a big impact on communities and can inspire, I really think was quite ahead of its time. Oops, we went backwards there. So I am very fortunate to be the 4th CEO here at Intermountain Healthcare. For those of you who don't know me, I returned to Utah after about a 20-year hiatus, the vast majority of which was at the Cleveland Clinic. I served as a pediatric critical care doctor and in a number of other leadership roles. And I spent the last 5 years in Abu Dhabi, starting Cleveland Clinic Abu Dhabi. And Mary Carol and I, and Mary Carol sitting in the second row, we were headed to London to live there and to start Cleveland Clinic London and execute on a global strategy when the opportunity to join you all here came up. And it was an easy decision for us to come and join, and a particularly easy decision when I understood the great leaders that I was going to follow. So we're very fortunate today that Scott Parker and Bill Nelson, the first and second CEOs, were here. And I wonder if they might please stand for a moment so we could acknowledge their leadership and the fact that everything we do today is based on what they laid out in front of us. Thank you. Unfortunately, Dr. Sorensen, who was my immediate predecessor, was unable to be here today, but just let me say he's been absolutely terrific helping me get started in my role. So great organizations have great governance, and we are no different, except that our governance is truly extraordinary. Currently, we have about 470 trustees who govern the various parts of our organization. As a not-for-profit, we do not offer compensation for this governance, yet they pour countless hours and great thought into understanding how Intermountain interacts with the communities and best serves the people who put their trust in us. And I'm deeply grateful for the guidance that I get, and I know the rest of us are. I wonder if our trustees might at least raise their hands so that we can acknowledge them, please. As a person who's been lucky enough to live and to serve overseas, I can tell you without a shadow of a doubt that there's no place like the United States of America when it comes to charity and service to others. And I look at our governance as a shining example of that. When I tried to decide whether this was exactly the right place to come and work and to lead, one of the measures that I used was, do people really believe in what they're doing? And a test I've always done is to try and ask people, so what guides you? Why do you come to work every day? One of the truly extraordinary things about Intermountain is that people live our mission, vision, and values every day. And they can articulate to you how their work connects with that. Our mission is to help people live the healthiest lives possible. Our actions and behaviors support that every day, although imperfectly, and we continually just strive to get better. But from an aspirational standpoint, I have never met a group of people who are willing to sacrifice to achieve a mission like the folks at Intermountain. Our vision, and this should sound fairly familiar given the history of where the system came from, be a model health system, provide extraordinary care and superior service at a sustainable cost. If you think about the plight that U.S. healthcare is in right now, this is the answer. So we are a mature, integrated system. We've got 22 hospitals, 2,800 licensed hospital beds, 180 medical group clinics, and about 850,000 select health members. You can see the dots are really where the people are, right? The jackrabbits get a little less care than the people when you look at the map, right? But we are all over the state where all the people are. We also are fortunate to have about 120,000 select health members in Idaho working with the St. Luke's Health System. I think a couple of their leadership are here today, and I'm very grateful for that. As an integrated delivery system, we're able to do things and make decisions based on the overall holistic good of the population and not on short-term profit and loss. One of my deepest beliefs is that we are all caregivers. Doesn't matter if you're pushing a broom, cutting a check, doing a heart operation, or doing anything else in our system. We believe that our caregivers must connect their behaviors on a daily basis to the patient, who is actually our greatest focus. So we're 1,500 employed doctors, 3,500 affiliated physicians, about 700 advanced practice clinicians, another 1,000 affiliated advanced practice clinicians. A third of the nurses in Utah work for us. We have 27,000 other caregivers, 1,600 volunteers, and all in all, about 39,000 human beings devote their lives to our mission, vision, and values. And we are the largest private employer in the state of Utah. Along the lines of great people, engagement drives safety, quality, patient experience, access, and stewardship, which I'll mention again in a moment. Gallup, a well-recognized organization, identifies great workplaces, organizations that have 7 times the average engagement. We've actually only 35 organizations have been distinguished across the world in this category, and we've done that 5 years in a row. Credit to our caregivers. Forbes and Computer World have also identified Intermountain as one of the superb places to work. We are very fortunate to have great financial stability. So if you look at our bond ratings, which is sort of like, the credit card score for a health system, we have the highest bond ratings of any health system in the for-profit or not-for-profit world. So why should we be excited about that? Well, what it means is that we can access money that we can put back into the community and pass those low costs on to the people who are our patients with great facility. This strength is only important based on what we can do for other human beings. So if anybody came for my prediction about what's going to happen in healthcare legislation, I don't have one. But I do know that these are challenging times, and I do know that Intermountain has tried very hard to play a responsible role as the world has changed. And we've actually worked hard around the Affordable Care Act to go ahead and make sure that we do everything we can for those who are less fortunate. I'll show you some statistics around our participation in the exchanges in a moment, but what I can tell you is that we continue to be quite dedicated to this mission, even though it has not always been financially great for us. So just to be clear, we're very financially strong, but the government still owes us $400 million based on the money that should have come to us based on the risk corridors. That has not deterred us from our dedication to caring for those who are less fortunate. We do know that regardless of what the strategies are from a legislative standpoint, the reality is that what we've been doing for decades around providing high quality at the most affordable cost, it's always the right strategy for the people. And we're going to stick with that regardless of what else happens. So here's some information from the exchanges. So there are roughly 200,000 people in Utah on the individual exchanges, and we at Intermountain and Select Health care for about half of them. We do, as many of you know from reading the papers and watching the news, many of the providers have actually exited. And in 20 of 29 counties in Utah, we're the only ones who are left. Now, this may sound like a huge business advantage to you, but it's not, right? This is an honor, but it's also an obligation. It's taking an enormous amount of effort on our part to make sure we take great care of people in the face of some pretty challenging financial times. So, as a good member of the community, we think about things in a number of different spheres. And we want our communities to be vibrant. So in addition to the highest quality at the lowest appropriate cost, we want our communities to be strong in other ways. And I'll give you some statistics that I think will speak to our commitment to that. First, I'd like for you to know that we care for about 1.4 million Utahns on an annual basis. So that's roughly 45% of the state. And over the course of a lifetime, we touch about 75% of Utahns. And this is something that we treasure, right? This is something that is actually a very important piece for us. So as I started to get to know the system and understand the state, I realized I didn't have a clear picture of what our overall economic impact was to the state of Utah. So we asked the Gardner Policy Institute at the university to go ahead and study this for us. We discovered some really interesting things. So when you think about our direct economic activity plus everything that goes around it, we actually account for about 6.5% of Utah's economy. About $436 million of state and local taxes. And this is my favorite statistic, and I'd like to just pause on this for a second. So we have about $6.5 billion in revenue at Intermountain with a margin of about $275 million. It's a lot of money, and it all gets plowed back into the community. Our charity care is 150% of what our margin is. So our margin is 275. We give back 420 to the communities in the form of charity care to people who are less fortunate. For me, that's about as good as it gets. Overall, the activity at Intermountain generates 143,000 jobs, $7 billion in people's salaries, and an overall economic impact of $10 billion to the state. We feel both very responsible and very pleased to be able to do things of this sort that are good for our communities and the people who live here in Utah. If we're going to be responsible, we also need to take care of the environment. We have lots of buildings. Every building that we're adding at this point, we're trying hard to have them be LEED certified. And so they're either gold or silver. And we're trying hard to make sure that we're responsible with resources such as water and electricity. Last year alone, we made an 8.8 million gallon improvement over our water usage. And living in the desert, that feels like a big deal. We've switched to LED lighting increasingly with savings of 2.2 million kilowatt hours per year. Every little bit counts, and as a large player and folks who are really dedicated to our communities, this is of great importance to us. Recycling. So the effort started in 2011 with a goal to recycle 30% of our waste stream. We're almost there. Right? We're up to about 6.9 million pounds per year. This year, we're going to add a food digester. I'm not quite sure what this looks like, but I'm kind of imagining a huge stomach of some sort. And we're going to add another 300,000 pounds to the recycled stream. So I grew up in a household where nothing was prized more than education and healthcare. And I'm really proud that we're able to reach the nexus of that at Intermountain. Over on a yearly basis, we commit about $36 million to the education of future caregivers, either by writing checks or in-kind activities. We trained almost 3,000 nursing students in our system last year. And we provide money to diversity candidates within nursing. And last year, 200 diversity candidates got financial support from us. This is very important as we seek to have a vibrant and diversified workforce and community. And then in the spirit of developing our caregivers, last year we spent $6.5 million on tuition reimbursement, helping our caregivers better themselves so they can better provide for the patients who are trusting us. Many systems, in fact, all systems, were mandated to do community health needs assessments. What I'm proud of is that this system has put these needs at the center of our strategy. So the items that are identified as of great importance are diabetes and prediabetes, high blood pressure, depression/suicidality, and prescription opioid misuse. We have system-level goals around each of these items that, by the way, generate no revenue for us for the most part. In fact, they're often a big cost. But our commitment to the community, our commitment to the future, it tells us from the inside out that this is really what we're meant to do. Enormous effort and focus. Let's take opioid misuse as an example. In our opioid community collaborative, we currently have about 300 people in treatment at any given time. We've committed $3.5 million over 3 years. We have a use only as a directed educational program. We have prescription drug boxes that have collected 11,000 pounds of prescription medications, 5 tons of prescription medications. We do physician and patient education. And naloxone is that reversal drug when somebody has had an overdose that can save their life. Very expensive and historically only available by prescription. We provide it at very low cost or for free and without a prescription. These are human beings. So this story is meant to remind me of a couple, both of whom were addicted to opioids, whose 14-year-old boy was taken away from them. As they went through the community collaborative and got clean and got healthy, they were able to get their son and their life back. This is all very real stuff, and I'm proud of what my colleagues, my fellow caregivers are doing, and I thank all of you for your collaboration as well. So no one can do things alone. So as we seek to make our communities healthier, Intermountain is big and we're strong and we're well organized, but we neither can nor should we do everything on our own. And we're very pleased to work with a number of others. So we make community contributions, last year to the tune of $13 million. We give grants last year to the tune of $4.5 million. And we work with community partners to the tune of about $650,000. The money is important only because of the human lives that it helps. So the Association for Utah Community Health, I guess commonly known as OUCH, provides support to 15 large independent community clinics. We've provided some money to help with community health workers, about $1 million. One of my favorite programs is this idea that we know that in a high deductible environment, there are many people who become functionally uninsured because they can't pay their copays. This program looks at patients regardless of who their payer is. It's not just for select health patients. Helps them get to a different tier so they can afford their health care more effectively and puts the power back in their hands. So over the course of my career, I live by a mantra of 5 fundamentals. It's what I think about every day, and this is the order that I think about things in. Safety, quality, patient experience, access, and stewardship. And all of that is enabled in the context of engaged caregivers who take care of those people. We've oriented our activities around these fundamentals. So let's talk for a second about safety. We know there are about 250,000 preventable deaths in the United States from medical errors and other problems. We've taken on a zero harm initiative with It's philosophy that has come from the nuclear power industry. Currently, we've trained 99% of our leaders just in the last couple of years, and 28,000 of our caregivers have been trained. We've seen an uptick in reporting of problems, and this is a good thing. This is a culture of safety of almost 26%, and we've had a decline in serious safety events of 30%. This is outstanding work, but this is work that is never done. On that front, I'd like to share a metric with you that we're not very good at. So compared to other major systems, we actually look okay. This is a condition called a catheter-associated bloodstream infection. So these are IVs that go into big veins, and they can get infected, and they can hurt and even kill patients. Currently, we're in about the 35th percentile to 40th percentile nationally. That's not where we want to be, and that's not where we will be next year. I want you to know that we know that healthcare is always aspirational. There are many areas that we're quite good. So when you look at readmission rates to the hospital, Intermountain Medical Center, where you're sitting right now, sits in the 99th percentile nationally. It's a very good thing. About 30 years ago, we began to recognize that reduction in variability, concentration of volume, leads to better outcomes for patients and is often more affordable. These 10 clinical programs have grown up around those philosophies. And I'd like to share a story with you from one of these programs.
I remember David as an individual who marched to the beat of his own drum. He never, ever left the house. He didn't tell me he loved me before he left.
I remember him as a great young man. Of course, I think fathers always look at their sons that way.
Well, you have to start with when he was 3 months old and he had his first asthma attack. But this last illness started with lung collapsing. He had what was known as adult respiratory distress syndrome. And when they realized that David could not survive the way he was, they explained to us about the research program, and they said to us very frankly, it probably will not save his life, but if he is willing to do it, it will contribute to saving of lives in the future. And I said to them, if you tell him that, he will say yes. And when they asked him, he couldn't speak. He had a respirator. He just went this way.
He was the oldest, I was the youngest, and he was my protector.
He used to call her his little buddy. I guess I first learned Amy was ill when she called me from the doctor's office and asked me to come get her, that she was too ill to drive. When they saw me pushing her in the wheelchair, they literally knocked me against the wall to get to her. And then I knew I was in trouble.
I did have the same thing that David had. It kind of hit me that I was really sick and she really thought I was going to die.
First moment when the doctor told me Amy had ARDS, my first thought was, I'm going to lose another child.
She looked at my dad and said, I can't do this again.
I had my first ray of hope when one of the doctors stopped me in the hall to give me some instructions. But in the process of that, he said, when you take her home.
For David, that willingly, in my mind, gave his own life, not knowing at the time that his sister would be one of the beneficiaries of his sacrifice.
And had somebody not taken his death and his illness and expanded upon it to the point where they can now save people with ARDS, I wouldn't be here.
When I look at her today, I think I might not have had this. Just continually swells gratitude in my heart. And now that she has a family and she's happy and pursuing her life, it just intensifies the joy.
I shall ever be grateful for the dedicated doctors and nurses that not only cared for David, cared for Amy, and I'm sure cared for many, many more. I'm so overwhelmed at the kindness and dedication and devotion that I saw there.
That's why I'm here. That's why a lot of people are here.
Well, today we're very fortunate to have David's mother and sister here. I wonder if they might stand for a second so we can express our gratitude to them. Thank you. So our cardiovascular clinical program was the first program that was formed. It was formed in 1997. When you take care of a person who's having a heart attack, the time that it takes to open up the coronary artery that's blocked often determines how well patients are going to do. The benchmark time is around 90 minutes. What we've done at Intermountain is using our transport system and using concentration of volume and lots of expertise is to achieve something that no other system in the United States has. So we've achieved 99.8% of heart attack victims on the Wasatch Front have had their coronary artery opened within that time frame. And that includes a lot of people who actually are flown to our hospitals here, with the time clock starting from the time they arrive in that outlying emergency department. This is an extraordinary achievement of leadership and clinical skill, and I'm very grateful to the caregivers who's made that possible for our patients. When a person's having a stroke, time is brain. And what we try and do is provide a patient with a clot-busting drug as quickly as possible, with the national benchmark of 60 minutes. When you look across our entire system of 22 hospitals, frontier, rural, secondary hospitals, and quaternary medical centers, we do that in 61 minutes all the way across the system and 35 minutes here at this particular facility. What I particularly like is that Intermountain Medical Center is the only Joint Commission certified comprehensive stroke center in Utah. And we're using telehealth to bring that expertise to our entire system and beyond. So it doesn't matter if you're in an itty-bitty hospital in a rural area or in a big urban medical center, everyone gets the same care. And that's really an innovation and something to be quite proud of. We know that mental health plays a big role in the overall health of a population. And there's a program here that embeds mental health professionals in our primary care clinics. This has been extraordinarily successful. For an investment of $22 per person per year, we save about $115. So it's a very rational thing that only payer providers can make that kind of investment. More importantly, people stay out of the hospital, they stay out of their doctor's offices, they spend more time at work, they're healthier. This innovation was recognized last week with the winning of the 2017 Hearst Health Award, beating out the American Heart Association and Stanford for recognition for a project that really changes population health. Again, very proud of the innovation that has come out of our clinical programs in service of others. I've noticed we make a lot of babies in Utah. And in fact, we have about 31,000 births a year in the Intermountain system. 60% of Utah births, actually, we're lucky to have in our facilities. What we've started to do is actually do teleneonatology, where high-risk deliveries can be attended by neonatologists via video, directing the resuscitation of the baby. And then evaluation of potential transports can occur to make sure that only the babies that need to leave their families and their communities actually leave. We've been able to avert about 55 transports in the last couple of years. Not a giant number unless you're one of those 55 families who was able to keep their baby close to home. We, like other organizations, follow our patient experience really carefully. The green line is actually the national average. The blue line is how Intermountain works. These numbers look great. We're very pleased with them, but we're digging in on a day-by-day basis to understand the areas where we aren't performing and seeking to get better every day, because it really is all about the patient. So many of you have heard on the news this idea of bending the cost curve in healthcare. The green line is where our costs should be. Our blue line is where our costs actually are. The delta this year was about $1 billion. This is money that was saved by collaborative work. This is, by the way, money that would have been extra revenue for us if we hadn't taken the cost out. But the way we look at it is, this is $1 billion that the communities don't have to spend on healthcare. And this is really, to a large extent, what Intermountain's all about. Be a model system, provide extraordinary care, make it accessible, and keep it cost effective. One of the major drivers in keeping costs down is our supply chain. Has saved about 2/3 of $1 billion in the last 10 years. And we're very proud of them. They were recognized as the #1 rated supply chain in the United States in 2016. One of the goals of having engaged caregivers is for them to tell us what's broken and how we can fix it. Last year, we had almost 900 continuous improvement projects at Intermountain that were driven by our own caregivers. It improved their engagement. It also helped us with some of this cost control so that care could be more affordable to our patients. And they saved us, our caregivers saved us almost $8 million based on their smarts about what really needs to happen. So we did mention the figure of $420 million of charity care. I want you to know that's 250,000 people that we were able to make their health care better, despite the fact that they didn't have the money to pay for us. And that we, on an annual basis, reached out to our communities to listen to the patients and the community leaders about how they think our charity care policy should be formulated. So this is not something we do just on our own. This is something we do collaboratively. So some of our activities are actually in schools. We have 4 community clinics that we run, charity clinics that we run, and we support another 48 others economically, as well as with personnel and supplies. So Mars is a kid who, his school nurse at their school clinic noticed that he looked poorly. He was losing weight, he was thin, he was listless, he was pale, and she saw him at school right at the point of contact. She discovered that he had diabetes. She made the appropriate referrals. He never got really sick. Things turned around, and this is Mars today, a healthy kid. We've had 450,000 of these kind of visits that have occurred in our community clinics, either ours or clinics that we support in the last year. Another way of improving access is by building buildings. And this also does contribute to the economic vibrancy of the communities that we live in. So in the last 5 years, we've had 41 major construction projects. We define major project as more than $5 million. Mary Carol, please don't ever think about a major project at our house, okay? We would be in big trouble, I think. But this is real activity that provides different kinds of access to people, again, regardless of their ability to pay. And over the next year, we have another $1.75 billion planned that we will invest in our communities to make sure that people have the right kind of facilities to meet their healthcare needs. One of my favorite projects recently is this van that you see. It's actually a bus, and it has 2 exam rooms in it. It's going to go into action in May 2017. It'll be staffed by a primary care doctor and an advanced practice clinician. And they will be active in Garfield and Piute counties, which, as many of you know, are very sparsely populated. And they're going to meet the patients where they live, how they want to be met, when they want to be met. This is an investment that we're pleased to make, and I think it really speaks to the future of the consumerism that's rampant in healthcare. We know that in a high deductible environment, people are very price sensitive, as they should be. And particularly for the millennials, they're very thoughtful about how and when they want to be seen. We've begun to develop a robust telehealth presence. Connect Care has provided about 4,500 visits up through the end of 2016. It's growing month by month. And you can see how a telehealth visit is about 1/10 of the cost of an emergency department visit. So we work hard to get people into the right level of care so they don't bear undue burden, and nor does the system. We also bring telehealth to specialists. We bring quality care closer to home, whether it's critical care, telestroke, crisis psychiatric care, newborn care, pediatric ICU, or antibiotic stewardship. We are able to support an entire system and actually beyond, using a little bit of technology and a lot of collaboration to the benefit of a population's health. This stacks up to about 250,000 consults to date and growing quickly year by year. This is the future, and it's not impersonal because people, when you talk to them, they get the warmth across the lines, but they're really grateful because they have the power to choose how they're getting interacted with. Again, this is what people want in this era, and we believe we want to see them where, when, and how they wish to be seen. We also do telehealth outreach outside of Intermountain healthcare. So we're in Montana, Wyoming, Idaho, Nevada, and Utah, and these are non-Intermountain facilities. Now, many systems, when they do outreach, their goal is to extract patients in the form of transports back into their own system to the economic benefit of that system, often to the detriment of families who need to travel. We actually take the same approach with these other facilities as we do with our own hospitals, and that's it. Let's keep people as close to home as we possibly can. What I can tell you is that we're going to be publishing some extraordinary results in the next couple of months that speak to a dramatic reduction in mortality for telecritical care that's provided outside of our system to patients who are in some of these smaller hospitals. This is good stuff. This is collaboration that goes beyond the walls of our own system. Now, if you do need to travel, we've actually moved about 65,000 patients to the tune of 10 million air miles over the history of life flight. And currently we have 7 helicopters, 2 turboprops, and a jet at our disposal to get people where they need to go regardless of conditions.
This isn't the way most patients are moved, though, right? Hanging below the helicopter.
This is not how most... That's the discount version, right? Yeah. Actually, that's a picture of our advanced hoist capabilities. So as a small aside, Intermountain's Life Flight is the only civilian organization in the United States that is certified to do high-altitude hoist rescues. And so we volunteer our time in the mountains helping people out when they get themselves into trouble. So let's talk for a second about investing in the future, getting upstream of chronic disease, a little bit about innovation, and a touch of thought leadership. So getting upstream, what does that mean? To me, that means let's stamp out chronic disease before it starts. Let's help people with our Live Well programs. And this is not just physical stuff. This is spiritual, it's financial, it's stress reduction. I think we have quite a comprehensive program that we're bringing to our caregivers, and we think increasingly to the communities in which we serve. Now, maybe my least popular decision as a new CEO, right? I hear the chuckles, right? Was starting to reduce sugar in our facilities. So no more sugared pop, no more candy in our hospitals. And people can bring it in if they want. But let's be really clear. We know that 40 to 50% of chronic disease is based on behavior. And we know a lot of that behavior is around eating. And my wife can attest, I have a far from pristine diet, okay? So I am not perfect in this regard. But it felt wrong to me and to us to provide people with things that we just know aren't good for them. And again, if they choose to bring those foods into our facilities, more power to them, but we view this the same as selling people cigarettes in our hospitals. We would never do that. We also seek to support community initiatives from a physical activity, from an environmental health, and other standpoint. We believe in helping people manage their own health, and the My Health app now has about 10% of Utahns, or about 300,000 people who are signed up, and it's a beginning of helping people manage their own health care, look at their labs, reorder meds, make an appointment with their doctor, communicate with their provider, etc. We are very fortunate to work with a lot of smart people, and the intellectual property that has propagated from Intermountain Healthcare is really prodigious. We have 4 companies right now that we have gotten started based on the activities of Intermountain. The first is Inteleer, which is a supply chain group purchasing organization, aligned with that terrific result you saw for cost savings and the #1 supply chain in the United States. Accelera is a specialty pharmacy business. Navican Genomics came out of a clinical program in our Southwest region to help people with advanced cancer have their tumors sequenced and identify, if possible, less toxic therapies that would allow them to lead healthier and longer lives, and what turns out at a lower cost as well. We've turned that program, which actually serves 5 foreign countries already, in addition to Utah and the United States, into a company called Navican Genomics, and it's off to a great start, and I know some of their leadership is here today. And finally, Empiric Health is a company that's based on some transparency technology that we've created that allows clinicians to understand the cost basis of what they choose. Within our own system, in the last couple of years, we've saved about $100 million using this. We believe it'll be helpful to others as they seek to improve the cost basis of their care and be able to serve their patients in a more reasonable fashion. We are a research organization and have about 1,500 studies that are open, but we're not a university. And we do treasure our relationship with the University of Utah. We see it as highly complementary. Our research is largely focused around care delivery, which is what we think we're really distinctive at. We have about 400 studies that are published annually, and we seek to improve that on an annual basis. The generosity of others, again, the roots of our system, continue to help us provide things for our communities, whether it's charity care or patient programs, research or capital projects or new technology. We're very grateful for the philanthropic efforts of the individuals who support Intermountain Healthcare. And many of you are in the audience, and thank you from the bottom of my heart. More importantly, thank you on behalf of our patients who benefit from your generosity. The Intermountain Chem Gardner Transformation Center is going to go up on the grounds of Intermountain Medical Center. It's going to house three different programs. First is Dr. Brent James' Advanced Training Program, which has now taught more than 5,000 leaders from 30 countries and 50 states the Intermountain way of doing quality improvement. It'll house our clinical programs, which I've talked a little bit about. And under the leadership of Dr. Charles Sorensen, who'll be the founding director, we'll have a new Intermountain Healthcare Leadership Institute, which will bring dyads, a physician and administrator, together from leading health systems around the world to spend time on a residential basis to learn how we drive quality, safety, patient experience, access, and stewardship. And one of the things I particularly like about what Dr. Sorensen envisions is, in addition to teaching the principles of leadership, he also is interested in the principles of leadership and how we can do the right thing and still be very successful in taking care of patients. Unbeknownst to us, a leading survey group tried to determine who were the innovation leaders in healthcare, and we were very pleased to be identified as the 5th most innovative organization in healthcare. What's particularly stunning is that increased by about 50% just over over a 1-year period. So we really think the way we do things is gaining traction, and we're glad to participate in sharing that with others. To that end, for the first time, Intermountain was included in the World Economic Forum in Davos this past winter. So we were asked to be a governor at Davos on the healthcare track. Only one of 10 delivery systems worldwide that was asked to participate and to lead and to share. Why is that? It's all the things I said. Help people live the healthiest lives possible, be a model system, be accessible, be affordable, drive extraordinary care. You can expect for us to continue to take this aspect of our mission very, very seriously. Thought leadership. Some people said, Mark, why would you want to share this stuff? And my answer is always, there's no secret sauce. This is all about the execution, and we're all in this business together, regardless of whether we're working together formally or not. So the 3 takeaways. The goal we have, healthiest state with the most affordable care. Intense focus on individual patients, and our belief that we're going to do everything we can to capitalize on our position to improve care locally, regionally, nationally, and internationally. Now, my contact information is in your handout. I hope you'll share only the nice things. No, actually, please let me know if you have any additional thoughts, if there are things you would have liked to have heard from us, or if you think there's additional work we could do, or if we should partner together. You may notice that a number of us have these One Intermountain pins on. So Intermountain has been an absolutely fabulous organization with lots of individual flavor and culture across our regions. And we don't want that to end. But what we must have is we must deliver on the promise to our patients that regardless of where they show up, if a procedure or a service is provided in more than one place, the quality is exactly the same. The experience is exactly the same, that we're consistent in delivering to them. They're trusting us, and we aim to live up to that trust. Now, I'd like to read you a quick letter that I got back around Christmas time. And 1 or 2 of you have heard this before, and I apologize for that. But for me, this is really kind of what it's all about. It says, Dear Dr. Harrison, it was actually January 28th that I got this letter. Thank you to Intermountain Healthcare for your financial assistance program. It has made a big difference for helping an unemployed poor person like myself. I have not had access to public or private health insurance since my last job in July 2016. I had gallbladder removal surgery at Intermountain San Pete Valley Hospital. The bill was almost $15,000. I despaired, wondering how I was going to afford this as Medicaid denied me since my wife and I have no children and I have not had any other income. I'm currently living with friends while I recover. Your financial assistance team has been a big relief. I just want to say thank you for how well I was treated by Intermountain medically and now financially. God bless, Galen. So, this is a big business and it's in the news and it has policy implications and human resources implications, what we do. But in the end, this is the most human endeavor of all. And I want to say thank you to you all for being our partners in serving our communities and helping people live the healthiest lives possible. Thank you very much, and we'll see you next year.